Antidepressants, the primary medications used to treat depressive disorders. Types of antidepressants include atypical antidepressants, tricyclic antidepressants, selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs. Atypical antidepressants, medications that do not fit into the other major categories of antidepressants, examples are bupropion, Wellbutrin. To gain a better understanding of depression, it helps to have a better grasp of the terms most commonly associated with depressive disorders. Antidepressants, the primary medications used to treat depressive disorders. They have been shown to improve mood, sleep, appetite, and concentration in many people with depression. Types of antidepressants include atypical antidepressants, tricyclic antidepressants, selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs. Atypical antidepressants, medications that do not fit into the other major categories of antidepressants, examples are bupropion, Wellbutrin, and mirtazapine, Remeron. Bipolar disorder, a condition in which a person cycles between longer periods of depressed mood and usually shorter periods of mania or heightened activity and irritability, sometimes referred to as manic depressive illness, and formerly called manic depression. Clinical depression, a term often used by doctors to refer to an episode of major depressive disorder. Cognitive behavioral therapy, CBT, a form of psychotherapy that can be helpful in treating depressive disorders. Double depression, episodes of major depressive disorders that are accompanied by a chronic, low mood, dysthymia, and that last for at least 2 years with little fluctuation. Dysthymia, a condition that is typified by symptoms that last a long time, usually 2 years or longer, but less severe symptoms than with major depressive disorders, also called dysthymic disorder. While not typically disabling, dysthymia can prevent a person from feeling well or functioning normally. Eating disorders, behavioral problems that are often associated with depression. These include binge eating, anorexia nervosa, and bulimia. Inpatient treatment, treatment that requires at least one overnight stay in a hospital or mental health facility. Light therapy, a common treatment for seasonal affective disorder, SAD. It involves exposure to bright man-made light for a certain period of time each day, usually supervised by a doctor. Major depressive disorder, a depressive episode that lasts more than 2 weeks and is characterized by feelings of sadness and loss of interest in normal daily activities, along with at least 4 of these additional symptoms: disruption in sleep, appetite, or concentration, fatigue, feelings of helplessness, hopelessness, or guilt, psychomotor slowness or agitation, and thoughts of death or self-harm. A person might have only one episode or many episodes of major depressive disorder throughout his lifetime. Mania, a condition characterized by excessive elation, a decreased need for sleep, grandiose thoughts, increased talking, increased sexual desire, poor judgments, increased energy, inappropriate social behavior, and irritability. Minor depression, an episode of depression that lasts for less than 2 weeks or during which the person has too few depression symptoms to meet the definition of major depressive disorder. Neurotransmitter, a chemical that regulates mood in the brain. Serotonin, norepinephrine, and dopamine are examples of neurotransmitters. Outpatient treatment, treatment that does not require an overnight stay in a hospital or medical center. Perinatal depression, a newer term for what has been called postpartum depression. The change was made to reflect the fact that many cases of postpartum depression actually have their onset during pregnancy. Postpartum depression, a type of depression related to childbirth that develops in about 10 to 15% of new mothers, also called the baby blues. Psychomotor slowness, a symptom of depression that refers to the slowing down of both motor skills and psychological activity. Psychotherapy, also known as talk therapy, a treatment often used in conjunction with antidepressants to treat people with depression. This therapy helps people gain a greater understanding of their illness and come up with strategies, tools, and skills for coping and functioning better in everyday life. The exact psychotherapy approach can vary based on the person's individual needs. Psychotic depression, a case of major depressive disorder or another severe depression that is accompanied by hallucinations, delusions, or another form of psychosis. Seasonal affective disorder, SAD, a depressive disorder in which symptoms typically start during the winter months when there is less natural sunlight. Light therapy may be used to treat SAD symptoms, sometimes in combination with antidepressant medications and psychotherapy. Serotonin, a neurotransmitter that affects mood. SNRIs, serotonin and norepinephrine reuptake inhibitors, antidepressant medications that alter the action of both serotonin and norepinephrine in the brain. Examples of SNRIs are venlafaxine, Effexor, desvenlafaxine, Pristic, and duloxetine, Cymbalta. SSRIs, selective serotonin reuptake inhibitors, antidepressant treatments that help regulate levels of serotonin, a chemical mood regulator, in the brain. Common SSRIs include fluoxetine, Prozac, sertraline, Zoloft, paroxetine, Paxil, escitalopram, Lexapro, and citalopram, Celexa. Tricyclic antidepressants, a form of antidepressant that can help restore appetite and sleep. Common tricyclic antidepressants include amitriptyline, Elavil, desipramine, norpramine, imipramine, tofranil, and nortriptyline, Pamelor.